everyone, it's Courtney from Unbound Medicine, and today I'm going to walk you through the basics of Nursing Central. Nursing Central is a collection of resources and tools that can be downloaded to your mobile devices and also used on the web. It'll provide you with all the necessary tools to answer questions in the classroom, lab, and clinical settings. Once downloaded to your phone or tablet, you won't need an internet connection. This short tutorial is going to offer a brief introduction to the resources and tools included in Nursing Central, as well as an example of how to use it in a clinical scenario. So let's begin. First, please remember that our support team is here for you. We're available by chat, email, and phone. While we provide a brief tutorial today, we have more tutorials on our Unbound Medicine YouTube channel. There I'll explain additional features and tools like how to make and use our mobile flashcards. You can find most of these under How to Unbound. Today I'm going to show you 3 items. The first is an overview of our resources and tools. The second is how to use Nursing Central in a clinical scenario. And finally, I'll show you the companion website. To begin, open the Nursing Central app. I'll demonstrate with my iPhone for now, but remember it can also be downloaded to tablets and Android phones. I'll use an iPad a little later in this video. Right away you'll notice several icons. Some are for resources, others are tools. First, we're going to focus on the resources. Let's open up Davis's Drug Guide. Davis's Drug Guide has more than 5,000 drug entries. It's regularly updated, which ensures that you always have the latest drug information. Davis's Drug Guide has been a top resource for over 30 years. Many students tend to default to search engines like Google for answers, but students and faculty have told us the answers in Nursing Central are easier to find and more reliable. I'm going to search for warfarin. Here you can see it's a high alert medication. We have the pronunciation, photos, and vital drug information below. Need to make a dosage calculation? The calculator's icon at the bottom of your screen will take you right to the integrated calculators. Pretty convenient, right? Let's open up Tabers. Tabers is your medical dictionary. You'll be learning a lot of new terminology, and this is where you'll find definitions for all of those new words. This resource has illustrations. I'll quickly open one of a liver and gallbladder. Images are not only helpful for personal knowledge, but for patient teaching as well. Tabers also has skills videos, and remember to read through the helpful information in the appendices, which includes fan favorites like medical abbreviations. The next resource is Diseases and Disorders. Diseases and Disorders gives you information on more than 240 diseases and disorders, and it explains the scientific basis for nursing care. The last resource we have in this package is Davis's Lab and Diagnostic Test. This resource helps you understand tests and interpret the normal and abnormal results. These other icons are for tools. Favorites is a way to save and organize important records. Notes allows you to create custom notes and highlights. Integrated calculators helps to double-check dosing, IV rates, or calculate important conversions. Prime gives you access to the full PubMed database. You can also keep track of nursing journals and find the articles you need for research or papers. And finally, we have Grasp, our mobile study card system that allows you to build, study, and share flashcards. I'll show you how to use some of these tools and a few others while going through the case study. As a reminder, for more information, you can find our videos on our YouTube channel or Instagram. Now I'm going to walk you through a clinical scenario on my tablet. In school, you will be reviewing case studies and working with patients, and you might be asked to create a care plan. I'll show you how Nursing Central can help. This is our case study. We have a 36-year-old white female. She's recently returned back to work after giving birth to her first child. We have her blood pressure listed, her heart rate, total cholesterol, HDL levels, LDL levels, and also her family history. Let's begin searching with blood pressure. Let's open Tabers on our tablet and type in blood pressure. You read here that the normal blood pressure is a systolic reading of no more than 120 and a diastolic reading of no more than 80. Our patient has blood pressure of 141/92. If you read a little further, you'll see that the systolic pressure exceeds 140 and the diastolic exceeds 90. The patient likely has stage 1 hypertension. Before moving on, you want to save this information to refer back to later for your care plan. You can see in the search bar above in the highlighted section that there's an option titled Note. When I choose Note, a yellow sticky appears. I can also choose between pink or green to organize my notes. I can now type or talk to text a reminder of any additional information. Monday's test. The note is now highlighted and waiting at home. The note on the home screen is linked directly to the area that you highlighted, so you can return to that page when you need to reference it later. Now you'll need to begin to look for additional information. The universal search bar is located in the upper right-hand corner of your screen. Tap it and type hypertension. Your search will generate options related to hypertension from the resources. Choose hypertension in diseases and disorders, and you'll search for the causes of hypertension. You can get there by scrolling or using the sections menu. Now you can begin to read through and gather more information about this disease. As you read through the introduction, you might find a word that you don't know. Let's look up endocrine. Nursing Central includes an in-text lookup tool called Glimpse. By highlighting this word and choosing Glimpse from the bar above, you're taken to the definition in Tabers. You don't have to leave the record you're in to find the definition you need. Glimpse can take you to the medical definitions and drug information that you need right away. Pretty handy to have at the tap of a finger. Alright, before moving on, tap the star at the bottom of the screen. This is a favorite. As I mentioned before, favorites allows you to organize and save important records to use later in your care plan. Let's say now you need to find drugs associated with hypertension. By using crosslinks, the two stacked arrows at the bottom of your screen, you can find information associated with this disease. Choose a drug, and it takes us directly to the drug guide. Again, you can see the generic name, images, the pronunciation, associated information, and calculators. Let's favorite this while we're in here too. The back button will take us right back to our first resource. Finally, you might need to know what labs should be ordered. Let's use crosslinks again to look for the lab and diagnostic test options. We'll choose cholesterol, and you're immediately taken into a new resource. You went from diseases and disorders to lab and diagnostic tests quickly and seamlessly. Let's favorite this one too. Now you've walked through some of the elements for caring for a patient. You checked out the causes of the disease, looked into any labs and tests, and looked for associated drugs. In addition, we used Glimpse to look up a definition, and we also took a note to refer back to later. All of this information that you favorited is saved for you right on the home screen to incorporate into your care plan. Lastly, as I said at the beginning, you have access to all of this on the web, which is linked to your mobile devices. Anything you do on your mobile device will be saved to the web and vice versa. Here's our home screen. The icons are the same. Favorites is located at the top taskbar and also to the right of the screen. You'll notice that all of your favorites saved from the app are also here for you on the web. The notes are all seamlessly saved as well. Let's do the same search for hypertension in the universal search bar. You can see the sections menu is already open to the left. Crosslinks is already open to the right. At the top, there are options to share, print, make a Grasp flashcard, and the option to cite your source right here. This will come in handy for any research papers. And that's the web version. All of your information stays the same in your account, and it's just as easy to navigate. I do want to remind you about Grasp, our mobile flashcards. You can find how to make flashcards right on our YouTube page. And that's a wrap. If you have any questions or suggestions or need any help with the app, please contact our support team. You can find their contact information inside of the application or on our website as well.